Hello everyone, welcome back, and I hope everyone managed to join. Okay, so we will start with Raynaud's phenomena, and so in the history, like we'll ask about any color changes in the digits or distal extremities, and associated features such as numbness or rewarming or pain. And we also ask about...
Sorry, Dr. Afra.
Yeah. Can you hear me?
So the patient is... Sorry, the patient is coming with what? What is the P1?
No, so the condition we're talking about, it's Raynaud's phenomena. So I'm going just to give a quick recap, and then we do the role play. That's okay?
Okay, yeah. Thank you.
You're welcome. So as I said, like they will present with the color changes. Typically start at the tips of their fingers and spread downwards to more digits and to their legs as well. And they also experience blanching, which must always be there. So, and the triggering factors such as stress and cold. And it's not continuous, like it's just comes and goes, but sometimes it becomes really severe, this Raynaud's phenomena. And so the complication, we need also to ask about if there is any ulcers, gangrenes, or severe ischemia to the digits. So this is the worst scenario. However, in the exam, he just presented with digital changes. There was no any ulcers or gangrene or any ischemia, but we have to exclude. You should always include in the history as well. And most likely the episode will be asymmetrical. So if the patient came with any presenting features in one organ, we need to ask about the other one. So in my right hand, what about the left hand? What about your feet? So always ask about similar locations. And we need to exclude secondary Raynaud's phenomena. So we will ask about connective tissue disease disorder, such as scleroderma and any digital vasospasm. So we can do capillary refill times in the examination to see if the digits are fine or not. If it's impaired, it means serious problem. So even in the exam, the patient capillary refill times was normal. Hopefully it will be the same scenario. So most of the time is benign and completely reversible when the triggering factor disappears. But as I mentioned, it could be like sometimes it become complicated and will become more frequent and disabling the patient life. So we'll ask also how this affected your life. And associated feature, as I said, we ask about numbness, any paresthesia, and we also ask about the frequency, how many attacks do you experience, for example, per day or per weeks, and how long does each episode stay with you? And also some of the triggering factors such as drugs. We will ask in the past medical history, are you taking any medications? And any medical condition like any connective tissue disorders. Also, we'll ask about smoking. Okay, yeah, and so we'll ask about other symptoms that could present in secondary, like Raynaud's, such as like any joint pain, any stiffness, any rash in your body. So ask about these symptoms is really important. Any weight loss. Okay, so I think this is the major things, and in the examination, just the most important things. So we'll do like all pulse, blood pressure, everything, but we should never forget about capillary refill time. It's a must in this station because it will indicate if the organ, like if the hand is well perfused or not, like if there's any ischemic changes, so it will like the treatment plan will change. And in the examination, we will do like full blood count, ESR, anti-nuclear antibodies. Yeah, I think this is all we need to do in the history and in the treatment. So we will do immediate admission if the patient has ischemic changes. That's why when we do a peripheral pulses and capillary refill times, if there is any indication of ischemia, so this patient for immediate admission. And if the patient has, we suggest any kind of secondary, like any symptoms, any arthritis, any joint stiffness, we will refer to rheumatology. And if the patient like had any occupational causes, we will also ask about their job and if there is any exposure to chemical or not. So we can consider referring to occupational specialist. And also like we will offer general advice, like please keep your whole body warm, avoid sudden temperature changes, and cover your hands and your feet by wearing gloves and socks. And stop like lifestyle advice, like stop smoking and try to minimize stress, exercise regularly. Yeah, so that's all about it, and it's really nice. So if the patient does not respond to simple measures, we can consider medication like nifedipine. So nifedipine can be used like just in need if the patient like develops the symptoms after exposing, for example, to the cold, or if the patient has severe symptoms, can use it like continuously until their symptoms improved. So it's like very flexible in the uses. And if the patient is not improved, we can just refer after nifedipine. So it's very easy station. When you know it once, I think you can. So let's do it straight away, and then. So I think this would be better. So just.
Sorry, Dr. Afaq, we have to exclude ischemia and what? Ulcer?
Like gangrenes, ulcer, yeah.
Okay.
Ulcer.
Okay.
Yeah.
So no DDs. Or
so
just
DDs. Yeah, so DDs like could be like, for example, cellulitis, any infection in the area, in a swelling. That's why we do ASR and CRP, so inflammatory markers. So we will see if he has any kind, yeah, of other things. But it's the most important DD is like, is it primary or secondary? So we should exclude connective tissue disorders from history.
Just ask, do you have any how can we ask? Do you have any other medical condition?
No, so we'll ask first about symptoms, like do you have any joint pains, any stiffness?
Okay.
Yeah. And then in the investigation, we will do like anti-nuclear antibodies and some kind of specific investigation, rheumatoid factors.
Yeah.
Yeah.
Okay.
So who wants to practice this session? Yeah.
I have one question here.
Yeah.
When we tell the patient the diagnosis, will we say that you have a condition called Raynaud phenomena, or we should say you have a condition called limited sclerosis? Because Raynaud phenomena is one of the features of limited sclerosis, yeah.
So just we'll say Raynaud phenomena for now, because we didn't confirm it by investigation. So the phenomena is just the symptoms he having, like syndrome, something, just a couple of symptoms he have. So this is what we can say at these levels, because we don't have any confirmatory test. just he has the phenomena, like whenever he exposed to the cold, his digits changing in colors and become painful. This is all the presenting in this man. So that's why we cannot describe it more.
No, we shouldn't say limit scleroderma.
Yeah. So I got your point, but we always avoid to name it unless we have investigation in hand. And they're not giving investigation, like they're not telling you if they call investigation normal or not.
Okay, that's fine.